When was Medicare created and why? Have you ever wondered how Medicare came to be and what led to its creation? Let's take a closer look at the origins of this important program. Medicare was created on July 30, 1965, when President Lyndon B. Johnson signed the Medicare and Medicaid Act into law. This act is also known as the Social Security Amendments of 1965. The program officially began providing coverage in 1966. The main goal of Medicare was to provide health insurance to United States citizens aged 65 and older, regardless of their income or medical history. Before Medicare, many seniors faced high medical costs and had limited access to insurance coverage. The need for affordable health care was growing, and Medicare aimed to address this issue. The roots of Medicare trace back several decades before its official creation. Discussions about government health insurance began as early as 1916. During the New Deal era, there were attempts to include health coverage as part of Social Security. However, early legislation focused mainly on old-age pensions. In the 1940s and 1950s, several proposals were made to establish national health insurance. President Harry Truman was one of the key figures advocating for this change. Although legislation like the Kerr-Mills Act provided some medical assistance to low-income elderly individuals, it was seen as insufficient to meet the needs of the population. The primary reason for creating Medicare was to ensure that older Americans could access necessary medical care without facing financial hardship. Before Medicare, many seniors were either uninsured or underinsured, as private insurance was often too expensive or unavailable. The establishment of Medicare marked a federal commitment to provide hospital and medical insurance through two initial parts: Part A, which covers hospital insurance, and Part B, which covers medical insurance. Since its inception, Medicare has expanded to cover additional populations, including people under 65 with certain disabilities and those with end-stage renal disease. The program has also grown to include more benefits, such as prescription drug coverage under Part D and Medicare Advantage plans, also known as Part C. This reflects ongoing efforts to meet the healthcare needs of its beneficiaries. In summary, Medicare was created as a response to the social and economic challenges faced by older adults. It provides a foundation for accessible and affordable healthcare coverage that continues to serve millions of Americans today.